demonstrating to you guys the urinary elimination. And we have a surprise for you. We have a friend coming to us and saying, "Hi, my name is Bladder, and I am sterile, so better keep me sterile." That's the message. So you learn now how to keep this guy sterile. Okay, we have those 5 rules. It says, check the doctors. Oh no, where is it? I'm lost. So that is what is provided for us, but I revise it. We have 3 checks and 5 rights for pharmacology. I revise it as the 5 N's in catheter rules. We have never put catheter on the bed rail, never lay catheter on the floor, never place the catheter above the bladder, never kink the tubing, never put tubing over the sidewalk. So that's 5 N's. So in case we're walking with our patient, we're helping our patient, and the patient has the catheter. Do not bring, girls, do not bring your catheter like your purse. Let it down there, below the bladder, okay? And so you know where to put the catheter. As I said, it should be by the bed frame, not on the bed rail, or lay the tubing on the bed, the mattress, or kink it, or else it will trap the flow. And the other people will do the rest.
Okay, some standard procedures for anything is we want to check your doctor's orders and to see what specimen, how much, stuff like that. We want to check your institution policies and procedures, identify your patient and for allergies, and do medical hand wash and gloves when appropriate. First thing we're going to teach y'all is how to do a sterile specimen and catheter. And what you're going to need is a 10 ml syringe, a biohazard bag, a rubber band, and gloves. And alcohol swabs. And a specimen container.
Yeah.
And currents in a...
Alright, first thing you have to do is wash your hands before you when you walk into the patient's room. And identify the patient, policy and procedures. You all know how to do that. So we're gonna go ahead and go straight in here. We're gonna go ahead and raise the bed and the head up. So I don't have my So wash your hands real quick, and we're gonna go ahead and check the catheter, make sure it's in place. So we're just gonna go ahead and expose what we need to be exposed. So just this part, and the first thing we're gonna have to do is get a rubber band and kink the tube. Oh, the bed roll down. Okay, it's down. This tube. Not on this one. Okay, so I'm gonna go ahead and kink it with your rubber band. Okay, then we're just gonna go ahead and go back in 30 minutes. So 30 minutes passed. Okay, we're already it's already in there. So we're gonna go ahead and get our syringe. And the first thing we're gonna have to do is wash our hands. And I don't have my hand wash, so let's just pretend. So I'll go ahead and put my gloves on. Alright, get your alcohol swab and clean the port. There should be like a port where you can actually get the specimen at. So just go ahead and open it. Then clean the inside and outside part. Then cross that out. Then get your syringe. Open it. Okay, make sure you have the 10 ml syringe. And it says in the doctor's order that we need to get 10 mils of specimen. So we're just going to go ahead and stick the syringe in there and twist it on. Okay, and so it's in there. So we're going to go ahead and aspirate 10 mils of the specimen. Then we're going to go ahead and take that off. And make sure you have your container. Just open it and just put the lid on can do that, right? Can we?
You
Okay.
can. You can.
All right, that one. Then you go ahead and put that specimen all the way in your container and make sure your syringe goes in your shot container. Okay. And put the lid back on. Put your label, date and time. Date and time initial on your container. Make sure it's on the container. Y'all know why? Because if you lose the lid, you're not gonna be able to identify the specimen. So so what you do is put in this the bag and okay, take your gloves off. Oh yeah, that's right. Just pretend that we have it on. Okay, rewind, okay. Alright. So already so I already had the specimen in the bag and everything. So we're gonna go ahead and clean the port. Okay, inside and out, so we already cleaned that up. So what we're gonna do is send this to the lab within 15 minutes. Then. Yeah, give me a sec. Dispose of that glove to glove, skip the skin, then medical hand wash. Then you unclamp the tube, take the rubber band off, and tell your patients, is there anything else that we can do for you or stuff like that. Then we're gonna go ahead and go to the nurse's station and document it.
And the next one is to empty the catheter into a fragment so you can measure how much urine you have.
Okay, you've done all your checks, the procedures and policies to patient identifiers, and you've washed your hands, you've explained to the patient that you're gonna empty the catheter and stuff. So, the catheter is gonna be in the bed frame, as they said, but I'm gonna do it in that catheter so that everybody can see it. So you're gonna have your urinal. You can use a graduate or a hat. It's easier if you have like this urinal because it has a handle and stuff. So you have your alcohol swab or pad ready because you don't want to reach into your pockets after you've touched the valve and emptied the catheter. So you just go ahead and open that one. And clamp this valve of the CDU. And after you unclamp it, there's one more clamp that you have to press on so that the urine will flow down to the urinal. So you go ahead and press that one. And then let's say that it's all empty and stuff. So you go ahead and clean the inside, like inside the tube or whatever, and then leave the outside. Put it back. Then after that, you assess color, odor, amount, and consistency.
Go ahead.
In the yes, in the bathroom. Make sure that it's in a leveled area. Read and then just empty it out. Clean and then place it in the bathroom.
Clean it with what?
Document.
Clean. You said
I
clean
did-
the urinal?
I
know
said
you
clean.
but what do you clean it with?
Water.
Yeah, they usually have a sprayer at the area.
Yeah.
Okay. That's all.
Okay, and
It will start stinking in the room.
our next one is clean catch.
Clean catch. So you have an order that says you want to do a clean catch. If you have a female, you want to tell her, you want to either give her the, sometimes, I don't know if you guys go to the doctor or whatever. They'll give you the wipes or you can just give her a washcloth to do pericare. You're going to tell her to separate the labia, cream from front to back, and then ask her to urinate about 30 to 60 mils. After that, she can either stop and continue to urinate in here, or she could catch it midstream, whichever way she wants to do it. For a male, if you have a male, if he's uncircumcised, before he even pees, you need to tell him to clean, pull the skin back, and clean in there, clean his penis, and then To get the clean catch, you're gonna do the same as the female. He needs to void 30 to 60 first, not into the cup, into the toilet, stop, and get the next one in the cup. And let's come back.
And our next one is the double voided specimen.
Okay. We're gonna share for, for supply purposes. So the first thing you're gonna do is you're pretty much gonna do everything that Lord has said. The only difference is with the second or double void, you're gonna wait for them to void for the second time. And this is usually done, you know, early in the morning. This is good for diabetic patients, and things like that. It gets a better read for the lab. So, you would wash your hands, check on the patient. You would instruct them, you know, let me catch, we're gonna get the second catch today. So after you urinate once, press your call light and let me know when you're ready for the second urine. You would go in the room and do you just pull this out. Wash your hands. If they know how to do their own pericare, let them do their own pericare. Wipe them from front to back, put on your gloves. And then if they're in the bed, you go ahead and assist them to urinate into a cup, or if they're ambulatory, they could urinate into one of the pans that's on top of her head. And collect it that way. And then you would time, date, initial, and label. And send it off.
Okay, now we're gonna do the 24-hour time specimen.
24-hour time specimen, okay. With this, your doctor's orders are gonna tell you specifically that you need to do one of these, and it's probably because they have some type of lab value that's abnormal, so they want to get a whole lot to test. So you're gonna go in and you're gonna tell your patient, we are going to need to collect all of your urine for the next 24 hours. Right after you tell them that, the next time they urinate, you don't take it. You take the next one, and then you have to take it for 24 hours. Tell them no feces, no tissue, it has to be straight urine. They can urinate somewhere else, like in a hat or in a urinal, but you have to get it in this, because this has to be placed in ice. And if they have a catheter, that also has to be placed in ice, and you'll have a tub like this full of ice that you'll have to change, keep it cold. You want to label everything. Do not flush urine. Put it in here, because if one of them gets flushed, just one, you got to start all over for 24 hours. So you should probably cover the toilet with a plastic bag, put label on the top, so that someone, when they come in, they don't flush it. Like one of us, with one of our patients, flushing it, and then the nurse has to start all over with us.
What if they do get toilet paper pieces in it, so you have to start over?
And that's real frustrating after 22 hours of collecting urine, all of a sudden it gets flushed.
You'll be able to.
Thanks. Now I feel the pressure. If I flush it, I'm gonna be
It's
upset.
all over.
Yeah,
It's over.
yeah.
Thank
Sometimes it means they can't go home until it's collected.
Yeah. And that's it for the 24 hours.
And our next one is our condom catheter, which Jessica's gonna show us. Okay, so condom catheter, you're gonna apply it when you're applying a condom. And currently I got that memo a little late.
That a little late.
Okay, you're not gonna detach the penis from your patient, okay? You're gonna leave it on him. But you're gonna come in, wash your hands, you know, to patient identifier, policy procedures, all that good stuff we learned early. Gonna put on your gloves, because I don't think anyone wants to be touching anything without gloves on. Okay. So, you're gonna go ahead and you're gonna do, you're gonna assess the skin. You're gonna make sure that it's not irritated or anything. If it's irritated, you're not gonna be wanting to put the condom catheter, because although it is like a condom, this has adhesive on it, so, yeah. That would irritate it a lot more. So you're gonna go ahead and inspect it. You're gonna be doing pericare if needed. Of course, you guys learn how to do that. And then, okay, that's where I was going to next. Do pericure if you need it. If there's any hair, you're going to want to go ahead and clip it. You're not going to want to shave it or anything because that would irritate the skin even more. So you're just going to kind of clip it as low as you can. Pretend my hands are scissors. So clip it really low. Okay, so you're going to go ahead and you're going to get your common catheter. Really, really sticky. Okay, so you're going to go ahead and you're going to apply it. If the patient is uncircumcised, you're not going to want to pull that skin back when you're applying it because it's just going to make it swell up. So you're going to want to make sure that the skin is frontwards when you're applying this. So you're going to want to go ahead and put that on there and leaving about 1 inch, 2 inch to breathe. And this is really sticky. You can see that. It doesn't work when your gloves are kind of based on you too. And you're just going to roll that on there if it wants to cooperate with you. Yeah, you can do it if you have gloves.
And you can have your friend grab a Holt for you and just hold on to it like
Help me help you. That's what you're telling me. Okay, so once it's on, you're going to go ahead and you might need to tape it around. You're not going to want to overlap the tape because that's going to cut off circulation. So you're going to grab the tape and not doing the tape because that's... Really?
Yeah, you have to show us. We don't know how to work the tape.
You find where you
Just, yeah, don't make it where it cuts off circulation.
Okay. You're going to want to tape on the catheter itself. You're not going to want to tape the skin. So you're going to want to go ahead and tape that. Go straight up in a spiral motion, not overlapping the tape. And that helps keep it in place. So in a nice spiral motion. Okay, so you're gonna want to go ahead and you're gonna connect it here to the.
You have to take the
This is
tape off.
kind of
Yeah.
on.
You can demonstrate with the other one if it's already glued.
Yeah, the other one's already. Over here. Okay, so the pretend are
Yeah, you can just get that also in the supply room usually just to see you.
This one's actually broken. And you're gonna just want to go ahead and just connect that,
And it's not as easy as it looks.
right,
Look a little.
into here.
See people can do that.
No one heard that. That's the only time you force something into a hole. You're gonna want to make sure it's nice on there tight, and you can put a little bit of tape on there, you know, if you're doubting or anything like that. Okay. And to go ahead and remove it. Remove this from here.
Huh? No, it doesn't leak.
You didn't see the adhesive?
After a while, usually the little man will take it off.
Yeah. So you're going to want to be replacing this every 8 hours. So you're going to have to be rinsing it. And then you're just going to roll it off. Nice and gently. You might want to put some adhesive remover.
Just be a little more gentle there.
it off without anything, like no?
Well, there's
some adhesive remover that you
Cut
can
all the
get.
hair off though. It's not.
Yeah, it's not to hair or anything.
There's some little pieces.
Okay,
Yes, I cut the
do it, that's why I said do it nice and gentle. Krisha over here doesn't
Yeah.
care about the nation right now. And you would dispose of this also, and then you would go ahead and provide peri-care again, and you're gonna be looking at the skin again, assessing the skin.
I'm
for any
sorry.
irritation or anything.
Can you repeat that? There's some people back here that can't control themselves.
Okay, everyone quiet. So you're gonna go ahead and you're gonna remove it, just gently roll it out. Once you're done, you're gonna dispose of that properly. You're gonna go ahead and you're gonna provide peri-care, the way we learned it, and you're gonna be looking at the skins for any skin irritation or anything, and you would be documenting that if you needed to. And then you would replace it again, continuously every 8 hours until you do not need it anymore.
Alright, I got a question. Okay, not to be gross or anything, but you're all like taping it up and it's all sticky. And you know, men, what happens if you get an erection? It's like,
It's actually
does
better
it
if you
move
have
or?
It's better, if you don't have an erection, that condom is not gonna go.
But what happens? But what
So
happens?
you want them to get an erection to
No,
put
that's
it on? Lord, it's like, it's actually easier, so
You're
I'm.
so sick, you're not gonna have an erection. But
Okay.
it could happen. It could happen.
And if it does happen, you just have to learn to be professional. You're not just gonna be like,
You either walk out,
We're a little
get somebody else to do
happier.
it.
No, he's kind of, no, he's wondering if it's, no, he's wondering if it's already on.
Yeah.
Not if you get one when you're applying it, once you get, like 2 hours later.
At the-
It's like tying some string around your finger real tight.
Yeah, it shouldn't be like that.
It shouldn't be.
it shouldn't be like, so it should be.
It is different from skin. They are just like condoms.
I guess that's why we spiral it on, because you're not wrapping it, so that if it would do that, it wouldn't be cutting off circulation because it's spiraled up.
They just be cutting off their
It's not tight.
The main reason you put it on this type of patient is usually they may have a UTI, but they're usually incontinent. So usually a little elderly man who's incontinent, he may be just a bit confused, and he's just incontinent, we're trying to keep him dry. Is that right?
We wouldn't put one of these on here.
What's the purpose of this one? What is so special? I couldn't hear because they talk too loud over there.
You're the one complaining.
I've been quiet. I've
Talking
been
when I was
quiet.
telling it. The purpose is to keep somebody dry. It's usually a little man who's incontinent. So you put a condom cap on, so you want to keep them dry, keep the urine off those. That's the reason.
Yeah, because with the elderly, urine, causes skin breakdown, and you don't want
Yeah, it's less invasive than a real catheter.
I prefer this one.
Yeah, most people would. But the problem is, it doesn't stay on.
Oh, the adhesive comes off?
Usually, the patient will take it off.
Oh.
They mess with it so much that it falls off. I would say that.
Questions? And that's the last one.